Hello and welcome. Today, we're discussing a crucial topic that could save lives. Recognizing the early signs of HIV. Identifying these symptoms early is vital because the initial stages are often the most dangerous yet easiest to overlook. HIV can affect anyone, but understanding the warning signs, especially in men, can lead to earlier diagnosis and treatment, ultimately improving health outcomes. Stick with me throughout this video because what you learn here could not only protect your life but also the lives of those around you. What is HIV? HIV stands for Human Immunodeficiency Virus, a virus that weakens the immune system by attacking T cells, which are responsible for fighting infections. If left untreated, HIV can progress to AIDS, acquired immunodeficiency syndrome, a much more severe and life-threatening stage of the virus. The silent nature of HIV. Many people, especially men, can carry HIV for months or even years without knowing it. This is why recognizing early symptoms is critical. While many of these signs resemble common illnesses, the persistence and combination of symptoms should raise red flags. How is HIV transmitted? HIV spreads through specific bodily fluids, including blood, semen, vaginal fluids, rectal fluids, breast milk. The most common transmission methods are unprotected sex, sharing needles, or coming into contact with infected blood. However, HIV does not spread through casual contact like shaking hands, sharing utensils, or even kissing. The virus cannot survive long outside the human body. The acute infection stage. After exposure to HIV, the body enters the acute infection stage, also known as seroconversion, typically within 2 to 4 weeks. During this period, the virus multiplies rapidly, and flu-like symptoms may appear. Because symptoms are often mild or mistaken for common illnesses, many people do not realize they are infected. Importantly, this is when people are highly infectious and can unknowingly spread the virus. Recognizing the early symptoms. 1. Flu-like symptoms. One of the first and most common signs of HIV is flu-like symptoms, including fever, sore throat, swollen glands. These symptoms occur because the immune system is trying to fight back against the virus. If you've recently been sexually active and experienced a prolonged flu that doesn't go away after a couple of weeks, consider the possibility of something more serious. 2. Fever. Fever is often an early and persistent symptom of HIV. It can be mild or severe and is usually accompanied by fatigue, swollen lymph nodes, sore throat. This happens because the virus enters the bloodstream, prompting the immune system to respond with inflammation. While fever is a common symptom in many illnesses, a prolonged fever alongside other warning signs should not be ignored. 3. Swollen lymph nodes. Lymph nodes, located in the neck, armpits, and groin, help filter harmful substances and fight infections. When dealing with HIV, these nodes can become swollen and tender, signaling that your immune system is under stress. 4. Persistent fatigue. HIV-related fatigue is different from ordinary tiredness. This exhaustion is deep and lingering, making even simple tasks feel overwhelming. If you're struggling to get out of bed or feel winded from activities that never used to tire you, it might be a sign of something serious. 5. Joint and muscle pain. Unexplained joint and muscle pain, especially in younger individuals with no history of injury or overexertion, can be an early HIV symptom. The inflammation caused by the immune system's response to the virus often leads to discomfort. 6. Skin problems. HIV can cause skin rashes, appearing as red, itchy patches, or widespread pink bumps. These rashes often occur during the acute infection stage. If you develop a sudden rash alongside fever or fatigue, it's worth paying attention to. 7. Persistent dry cough. A lingering dry cough that doesn't respond to antibiotics, inhalers, or home remedies can be an early sign of HIV. If you or someone you know has a chronic cough, especially in combination with fatigue or fever, it's time to take action. 8. Digestive issues. Frequent diarrhea, nausea, and vomiting without an obvious cause, such as food poisoning or a stomach virus, can be early warning signs. Persistent diarrhea lasting more than a few days, especially if unresponsive to standard treatments, should not be ignored. 9. Night sweats. Waking up drenched in sweat despite sleeping in a cool room can indicate early HIV infection. Unlike occasional night sweats from a bad dream, HIV-related night sweats are intense, frequent, and unexplained. The importance of testing. Not everyone with HIV experiences all these symptoms. Some may have only one or two, while others remain asymptomatic for years. That's why regular HIV testing is crucial, especially if you belong to a high-risk group. Early detection and treatment. Early detection of HIV can dramatically improve health outcomes. Modern medications can effectively manage the virus, preventing it from progressing to AIDS and allowing people with HIV to live long, healthy lives. Prevention strategies. The best way to protect yourself and others from HIV is through prevention. Practice safe sex. Use condoms consistently and correctly. Avoid sharing needles. If you use intravenous drugs, never share needles. Get tested regularly. Early detection is key to managing HIV effectively. Educate yourself and others. Spreading awareness helps reduce stigma and transmission. Take action. If you believe you've been exposed to HIV, don't wait for symptoms to appear. Get tested as soon as possible. The earlier you catch it, the better the outcome. Final thoughts. HIV is a serious condition, but with today's medical advancements, people living with HIV can lead full and healthy lives. The key is early detection and prevention. Pay attention to your body, recognize the signs, and seek medical help if something feels off. By being proactive, you're taking the first step toward protecting your health and the well-being of those around you. Thank you for watching, and remember, knowledge is power. Share this video to help spread awareness and prevent the spread of HIV. Disclaimer: the information provided in this video is for educational purposes only and should not be considered medical advice. Always consult a healthcare professional for accurate diagnosis and treatment options.